Welcome, welcome. So in my practice, I am exclusively dealing with dogs and cats that are pets. So some of this is not going to work very well for your farm animal practice because clearly it's not the kind of thing you can do in regular farm practice. Um, Yeah, we'll get to it as we go. I just noticed in that video there was some scenes of animals having surgery. It looks like you're using a chemical anesthetic, and that would be okay for some dental procedures. But if you have the ability to protect the airway of these animals when you're going to be doing any dental surgery, placing an endotracheal tube, even if you don't have a gas anesthetic, would still be a very good idea to protect the animal's airway because dental surgery involves a lot of blood and liquid and stuff. So that was just one thing I wanted to bring up. Okay, well, this seminar is to give you a grounding on what is normal and what is abnormal from a dental point of view. So let's get started. Okay, so let's get started. So why does dentistry matter? Obviously, bad teeth are a problem in and of themselves, especially for animals that rely on their teeth for getting food, to be able to kill animals and to chew the food. But for pets, dentistry, having teeth is not as important, but having healthy teeth is very important because if you have that infection, it can spread to the other parts of the body, whether it be liver, kidney, heart, sometimes even to the bladder. And then immune issues from the stress of all those infections ultimately can affect life expectancy. The chronic pain can lead to all sorts of issues as well. One thing that's interesting for pets is if your pet stinks really badly because of bad dental disease, there does seem to be the owners tend to keep the pets at a distance as a result, physically because the smell is bad, which also affects the kind of relationship that they have with the pets. And so it's important that way from a pet point of view, so that people will still bond and be close with their pets. So dental anatomy. This is a picture that gives you a rough idea of what is going on with the tooth. So the structure of the tooth is largely dentin. We have the pulp cavity in the middle, and we have this little enamel cap on the top. Now, for people, oftentimes we focus on the tooth, but with animals, it's really, really, really important to focus on the periodontal disease. So this little section here where the gum meets the tooth, we have the loose gingival or free gingival area, and then we have this attached gingiva in the section below that. And then we have the tissues of the mouth beyond that. But this area here between the enamel, the free gingiva, the attached gingiva, and the mucosa, that is where we tend to focus most of what we're doing from a dental point of view for animals, because that's where the infection is, and that's where we need to focus. So that gingival sulcus, again, as I said, that is the essence of what we're doing from a veterinary point of view. This area is always in a state of disease. It's like a war zone. You have enemies on one side, enemies on another, and this no man's land in the middle, that's what the gingival sulcus is. So you have normal bacteria trying to come in, you have the the immune system and the host defenses trying to fight off that bacteria, and that tension is where we live. It's important to note that some of the bacteria that live there are anaerobic. So when you're choosing antibiotics, excuse me, when you're choosing antibiotics, we must make sure that we choose an antibiotic that would cover that anaerobic bacteria. One of the ways we measure the health of that gingival sulcus is to literally measure the depth of it. And normal depth for a dog would be 2 or 3 millimeters, and cats less than 1 or 2 millimeters. When there's the infection has the upper hand, the pocket gets deeper and the host defenses retreat, ultimately leading to deepening and deepening of that sulcus, and eventually we can lose some of that attachment of the bone. So keeping that sulcus healthy is our goal. If we can't keep that sulcus happy and healthy anymore, that's when we have to extract the tooth. So what is the problem for dentistry? It's that infection in that periodontal pocket. And we characterize it into roughly 4 stages because there's different things that can be done at the 4 levels of disease. And so we're going to go through that right now. So stage 1, we just have a mild gingivitis, that infection right at the boundary between the loose gingiva and the enamel. Grade 2 gingivitis, we're starting to get deeper, and grade 3, it's getting very deep, and grade 4, we're in deep trouble. So we're going to go into more detail about what those stages are. In addition to that, there are a whole host of other diseases that we're going to encounter as we look in the mouth, and these odontoclastic resorptive lesions or tooth resorptions in cats is one of those, and in dogs we have all kinds of fractures that we have to address as well. So we'll look at those different stages. So grade 1 or stage 1 of dental disease, we have a mild amount of plaque and calculus above the gum line, and we have that early gingivitis, just that red line along the edge of the tooth. Often you'll see this in a young pup or a kitten at the time that they're teething, and that is usually reversible on its own, but that will show you that red line, that very mild gingivitis. There's no problem with the, sorry, my screen moved on to something here. I just need to go back. Previous slide, there we are. So there is no attachment loss at the tooth. There's very minimal depth of the pocket, and this stage is totally reversible once we clean off that tooth and get that gum healthy. So here's a picture showing that loose gingiva, a bit red there, your calculus and stuff there. Once you get that cleaned up, that tooth will be perfectly healthy again. Again, here's a dog, very mild amount. You can see some bleeding after a probe has gone into the pocket there, but this is mild stage 1 disease. So stage 2 is that we have all of the above from stage 1, but we also have problems with the attached gingiva. So again, this is the loose gingiva right at the edge, but then between here and here is the attached gingiva. And so it's often quite swollen and red and angry. And even when you just touch this area with your finger, it may start bleeding. At this stage, we haven't had the gum recession. And once we get that cleaned up, usually they're quite healthy as well. At this stage, we also have a lot of this tartar, which is calcified plaque. So plaque is formed by the bacteria that live in that gingival sulcus. And it only takes 48 hours for that plaque to start getting calcified. And that calcified plaque is what we call tartar. This can start to be painful. And this is extremely stinky. There's a lot of bad breath that comes from this. And the owners are often affected by that when the dog is sitting in the car with them, panting. Ooh, that smell can be strong. Also, cats can have a very strong odor. They can yawn in your face, and it's like, whew, that is strong. So those are some of the things you'll see for grade 2. Again, on the picture here, you can see not only is the area at the base of the tooth affected, but this whole area of attached gingiva is much more pronounced, much more swelling all the way back in this area here. So be looking at the attached gingiva. Here in a dog, it's a little easier to see that attached gingival line. As you go through the mouth, you can see that sort of where the mucosa attaches down. That's what we call the attached gingiva. And you can see in this picture, even though the color is black, you can see that raised area there. So grade 3 is like grade 1 and grade 2, plus we're starting to see destruction of the tissues. So we're starting to see the gum that used to be attached at this level has receded down. And we're starting to get the exposure of the dentin part of the tooth. The enamel stops at where the gum used to be, but we're now getting exposed dentin. And that part becomes irreversible. Here's a tooth here. You can't really tell from looking at it how severe it is, but once you clean it, you can see that we have lost some of that attachment there. So grade 4 is like all of the above. We have all that cherry red gums, the bleeding of the attached gum, but now we also are seeing bone infection and bone loss from all the infection and calculus that's there. This becomes not only painful because of the gingivitis, but once we have significant loss of attachment, a loose tooth is very painful. Not only that, a loose tooth is very prone to having a pumping action that will take all that bacteria that is present, and you have this socket that is supposed to receive the root. The root is in there, and now it's moving back and forth. That creates a perfect pump that gets the bacteria that's in that sulcus spread through the bloodstream. Once you get to stage 4, there's nothing to be done except removing the tooth. So extractions are usually required when we're dealing with grade 4 dental disease. And again, here's an example. Looking at the back, not so bad, but if you look at the front here, we can see a significant amount of periodontal loss around this canine tooth. Here's a cat, which is very interesting to see. Not very much gingivitis at this stage, but we've seen that this cat has had very significant periodontal loss in the past. This is where the enamel used to be, and it has receded down to here. So at some point, this cat has experienced some significant periodontal loss. Clearly, this is stage 4. You can see all the pus, you can see the calculus, you can see the recession of the gums. It's not a healthy mouth. Likewise, this one is in the same category. Now, the interesting note here, something I want to do study on at some point, is the impact of hair in the mouth. I believe is a significant contributor to ongoing periodontal disease for dogs. I'm not sure how many of you men have long beards, but I tend to keep my mustache trimmed very short because I don't like having hair in my mouth. But these that never sees the light of day, you can see it's turned brown. This is re-inoculating nasty bacteria into the mouth every time they lick their lips. So I'm a big advocate of shaving some of that hair to prevent ongoing periodontal disease. So here's a couple more examples of just how advanced that stage 4 dental disease can get. A very, very thick amount of calculus, and underneath this, all manner of destruction lurks. And cats are not immune to this either. In cats, not only will you get the attached gingiva, but you'll also see some of the other mucosal surfaces show, I call them canker sores, but ulcerated areas where the infection is constantly in contact with the gum. And often on the inside of this lip, you will see little ulcerated areas from chronic infection. And I believe that to be fairly painful for cats. I've touched that on cats and they don't like that. So in this cat, what would you say is your diagnosis? Take a few minutes and look at the picture. What are all the problems that we see in this mouth? Well, the first thing is this inflamed tissue that I was talking about. We have the attached gingiva inflamed there. We've got, whoa, we have a missing tooth. There's a tooth already gone. And down on this bottom one, you can see that we've got some gingival recession as well. It can be cleaned up. Everything can look good, but how do you know that it is good? You must probe that pocket to measure the depth of the pocket, and that's the only way you can tell whether there's recession, because on the surface, it can look good, but it's below the surface that's important. So one of your most important dental diagnostic tools is this Dental Explorer. I stress this again and again and again. It's a simple tool, but a very powerful tool. It's interesting to note the gradations on this one as well. I like to see millimeter markings on here. Sometimes you can get inexpensive ones that just have bars of 3 millimeters at a time. So a black bar, which would be 3 millimeters, and then a white bar that would be 3 millimeters. Because in humans, 3 millimeters is the magic number. Whereas with dogs and cats, I think it's more important to measure that specifically. So those are your 4 stages of dental disease. But as you go through looking for the dental disease, you're going to see a whole host of other diseases. And I would say almost all of these problems that we're going to encounter are going to be treated by extraction of affected teeth. Now, as was mentioned in the bio at the beginning, I am not a dental specialist. I am a general practitioner, and I have a special interest or enthusiasm for dental disease because I believe that extractions are the realm of general practitioners. And even if you're in remote areas of your country without access to all the fine tools that I may have when I'm doing surgery in a sophisticated hospital, extractions can be done almost anywhere, particularly for some of these severe cases. So extractions is definitely within the realm of a general practitioner, and it just takes practice, practice, practice to get better and better at it. So let's run through some of the problems that you're going to encounter as you're doing a thorough dental exam. Number 1 on the list, I think, is retained deciduous teeth. So here you have your baby tooth of the canine, the fang tooth, depending how you call it, and the adult tooth there. I don't know whether that's a Canadian genetic thing or whether that is true around the world, but this, I would say, is one of the more common faces of dental disease. And you're going to see it in all sorts of shapes of dogs. And the problem with it primarily is, you remember our picture here of what the dental anatomy looked like? When you have a retained deciduous tooth, you have a change in the anatomy. So you've got a baby tooth sitting here, your adult tooth here. Well, what's the problem with this? The number 1 problem is we don't have a periodontium. We don't have this sophisticated structure of the free gingiva, the attached gingiva, and that battle zone. We have just tooth against tooth. And as a result, the bacteria are able to progress deeper and deeper and deeper between the 2 teeth, ultimately leading to tooth loss and infection. So it's really important to deal with those retained deciduous teeth. Now, sometimes it's hard to examine a dog. I understand that, but muzzles can be your friend. In fact, I do a lot of dental exams with the muzzles because I need to get into that mouth and see what's going on. It can sometimes be quite painful. One little trick is to use an oversized muzzle so that you can peel the lips back and take a look at things without losing a finger in the process. So this dog, as you can see, is just beginning to teeth. He's got his adult incisors here and the adult canine here. And unfortunately, it didn't line up properly. And so the adult tooth, instead of coming underneath the baby tooth, cutting off the root and having the baby tooth fall off, the adult tooth developed in front of the baby tooth, leaving the entire root of that baby tooth there. And so now we have, you can see the inflamed gingiva right there as well. Here is one that had that problem, but the baby tooth broke off. Now, in Canada, I have heard some people say, oh, if your dog has got the baby teeth that didn't come out, give him a bigger bone to chew and he'll break it off. Well, yes, that's true. He will break it off. But the problem here is the root of this one is still here, and the root of these teeth go way back. Now, if you can see here at the top of the picture, you can see a little red area here. That's the apex of this root. When that tooth has been broken off, infection gets into the root and goes all the way down to the apex of that root. So that tooth needs to be extracted. Here's a bad case. Not only does it have retained canine teeth, but a whole row of incisors as well. And that is not going to be a healthy mouth no matter how you look at it. The consequences of that is those adult teeth now are being directed narrowly. They're not going to go outside of the mouth. We can have abscesses at the apex of those baby teeth, and we can end up with severe periodontal disease of that adult tooth. And the bad apple can spread through the whole bushel. The bad bacteria around one compromised tooth can spread to the entire mouth. So I like to make sure that we have a healthy mouth, and then it can stay that way. So here's an example of some of the occlusion difficulties that we have. Those canine teeth on the bottom are now very narrow. So instead of coming out in between number 3 tooth and number 4, it's coming out under that tooth there. And you can see that the 3 tooth, so 103 and 203, are being pushed laterally by those fangs coming up from the bottom. Here are a collection of pictures of various base narrow teeth that have come about, often because of the retained baby teeth. And you can see the divot in the palate where the lower tooth has been jamming its way in there. And in this case here, you can actually see some granulation tissue that is building in that area. So fairly common problem here in Canada. Not sure how common that is for you guys there, but it's really important that we get those baby teeth out of there early and avoid the abscess that can form from broken ones or just the infection spreading down there. So here's one here where the infection had spread all the way to the apex. Here's another tooth of a dog a couple years old, and you can see there's the baby tooth there, and as a result, this dog has had chronic bacterial infection in that sulcus, and it has spread to all the teeth around it as well. Notice the very red gingiva here. When you go to extract those little teeth, beware. They have roots that never end. So this is a series of baby teeth that I took out of a dog that had an occlusion difficulty. But it's important to note that ratio, that 1:9 ratio of the incisors. So you have crown, that is 1, and you have root, that is 9. If you break off this root, you will live to regret it. That root will often fester like a sliver, and what used to be a dental problem now becomes not only a dental but also a medical problem because you now have an abscess. So be very careful when you're extracting those teeth to not break them off. Okay, so we've now talked about the baby teeth. Let's move on to talk about different malocclusions that you might encounter. So this is a picture of a dog that has, I'm going to say, not a bad occlusion, but it is still a problem. You can see this canine tooth is not coming out of the maxilla, and this, in terms of occlusion difficulties, I would say is one of the more common ones I see. This will have consequences. This will start to push on this tooth. And so if we can address some of these at an early stage, we can do a big benefit for the animals. This was my dog. She had a very good occlusion, not perfect, but you can see that we are much better than the next slide, which is this one here, which happens to be one of her sisters. And you can see the difficulty that has happened over time with those incisors hitting up against each other over years. Those periodontal ligaments just get tired, and you can see that this incisor, I've lost my mouse there. You can see this incisor is now loose enough and has been pushed off sideways, and you can see the pus in the pocket as a result. So occlusion difficulties are very important. This is one of those base narrow canine teeth that we were talking about. Can you see the problem here? This dog here, that canine tooth doesn't have room to come through altogether. Now this dog's mouth is closed and the tooth is making contact with the incisor. Big tooth against a little tooth, which tooth do you think is going to win? Yeah, the smaller tooth tends to be worn away by the constant wearing. Another thing to note in this dog is, as a result of this tooth making contact here prematurely, these incisors are not actually occluding with each other. And likewise, the molars in this dog are not going to be occluding properly either. So every time this dog closes his mouth, there's a chunk where those incisors, or where the canine teeth hit the incisors. So occlusion difficulties, very important. Can you see the occlusion problem here? Right there. Similar to what we were talking about with the retained deciduous teeth, when you have crowding issues, you do not have periodontium between the teeth. And as a result, you can have a very deep pocket develop. This is a very common area in dogs to have some crowding issues. Another area where we see crowding is between the 4 and the 5 tooth. Sometimes there's just not enough room there. And when they're crowded together, that becomes that nidus, that spot where infection is going to start and then spread throughout the whole mouth. So here's a couple pictures of, again, common areas. Boxers and pugs tend to have a lot of occlusion difficulties. And here's one where we have the 7, I believe this is 307, right up against 308, and no periodontal space there. Again, this is a pug. You can see between, now this would be 107 and up against 108. Right in this area here, we have tooth right up against tooth, no sulcus there, no protection there. My favorite dogs, a pug mouth. You can get the entire mouth in one photograph. Not very common you can do that. But look at all the problems here. We have some crowding here. We have some crowding there. Do we have some crowding there? Let's look closely. No, it does look like there is some gingiva in between. Up here we have some crowding, and we have so much crowding that we've actually pushed the tooth out of its normal position. It can be a real problem. Here's a dog that has a longer jaw, but can you see the crowding issues here? Right in that space. And again, premature periodontal disease in this area. Look at all the calculus forming. Look at the inflammation around the attached gingiva here. And look how deep the pocket can be. This is a fairly young dog. Look how healthy this tooth is. And yet we've got almost a full 4 or 5 millimeters in this area. And untreated, it's just going to progress. Look at all the disease here. And it gets worse. Okay, so those are some of the more common dog malocclusions. Let's not forget about our cats. Cats can have occlusion difficulties as well. I'm not sure if you have a lot of the brachiocephalic cats, but with the Persians, it's quite common to have a lance canine where the canine tooth, instead of being in its proper position with the upper canine behind the lower canine, in this case, the upper canine comes more forward. And that can lead to crowding issues up here in the incisors and chronic damage as well. Okay, so that is the issue of malocclusions. The next thing you need to be looking for is deformed teeth. Now, in unvaccinated animals, distemper virus can be one of the things that if the bitch is exposed to that during her pregnancy, it can damage the tooth bud, and you'll often see enamel defects in that, but almost every time you see an enamel defect, there will also be a problem below the gum line as well. Again, in your rural practices, you may not have an opportunity to take x-ray, but you need to be prepared when you're dealing with a deformed tooth to expect problems below the gum line as well. In the category of deformed teeth, I also put in there doubling of teeth or supernumerary teeth. In this case, the cat has got two of these, I believe those are 308 and 308B. The term for this is called gemination, basically twins, Gemini. And so the tooth bud at some point gets split in its development, and we end up having two teeth. Obviously, those teeth are not going to be healthy. They don't have a periodontium between them, and you often see infection in that. Now, be aware when you're dealing with these Gemini's teeth in cats, often you'll have a shared root in the middle. So again, if you could take x-rays, it would be great, but again, that's limiting. Here's a dog's big carnassial tooth. Doesn't look all that bad in the picture, but you can't really see the three-dimensional aspect of it. This tooth actually does a 90-degree and come out at you. And clearly that's going to lead to some occlusion difficulties when they chew down. Okay, in addition to deformed teeth, and again, this is what you're going to see often in your rural dogs or your stray dogs, chewing on all sorts of things. This is a major molar, the lower carnassial, 309. This is on a bull mastiff. This dog was hit by a car, and this is the only damage that the dog sustained. The car, however, lost its grille, its headlights, and front bumper. It was a massive dog. And this we didn't find right away. It took about 3 or 4 months for us to find this because it was split right down the middle. A very unusual fracture, but there you go. This is much more common. Dogs that like to chew sometimes start chewing on rocks and can break off the enamel, or on bones. That can happen. This is a dog who has a fetish for chewing on logs that happen to have nails in it, and so he's chipped a number of teeth here. These ones have been able to be worn, and the body has brought some healing, but you can see this one's chipped and the pulp of the tooth is exposed, and in fact the whole lower canine on this side is now gone. So watch for those fractured teeth. Very common fracture of dogs is this carnassial tooth, so number 8 on the upper arcade. We call it a slab fracture, and the pulp of that tooth is quite likely exposed underneath all that infection. So when you're looking at your dental exam, the two areas that I would say you must look at every time is when if the dog is fractious and you put a muzzle on it, look at its canines and then pull back its lip and look at that carnassial tooth. It's so common to have fractures of that. Again, another picture of a dog with a similar issue, and I think the next slide shows the pulp exposed. Once we've taken that flap away, you can see just how much that pulp is exposed, and it's all rotted away. Here you can see that flap nice and loose there, and again, the attached gingiva behind it quite inflamed. Those teeth need to be extracted. Here in Canada, this is one of my #1 issues. People giving these nylon bones to dogs. They love to chew on them, but the nylon doesn't give way. It starts to become really thin and hard, and the dog chews and chews and chews, and then snaps the tooth. The other issue I have is these baked bones that The best part of the bone for the dog to chew on is the head of the femur, the soft cancellous bone. But the butchers like to keep that for themselves and give the dogs the shaft of the bone. Well, they're going to break their teeth on that very commonly. Another problem we've run into in Canada quite commonly is people liking to give tennis balls to their dogs to play with. Here in this dog, you can see the tip of the canine teeth has been worn away because this dog loves to play with tennis balls. As you can see, he's worn the coating right off of that tennis ball. And if you imagine, there's the shape of the tennis ball, and it has ground the teeth off accordingly. An important thing to note, the difference between a broken tooth and a worn tooth. A broken tooth, the enamel has been removed suddenly, and now the dentin and sometimes the pulp of the tooth is exposed. However, if that damage is slow with a wearing process, the body is able to put a patch on that damage from inside the pulp. And so we call that tertiary dentin, that third level dentin. The first level becomes enamel. The second level of dentin is the structure of the tooth. But this patching, this third level of dentin, is filling in the pulp cavity underneath the damage. And if the damage is slow enough, we'll have a complete patch of that area, and the dog can live with it. So you always have to be looking very closely at the teeth to see, is this a wearing away or is this a fracture? Here's a good photograph of this. This is a dog that I was investigating from a cruelty point of view because we didn't know what happened with this dog, but every tooth in his mouth was flattened to the gum line. And the question was, did this dog have his teeth cut or did they wear away? I suspect in this case that he did have them cut because although you can see some wear here, this brownish pigment is your tertiary dentin filling in the pulp of the tooth. But here you can see the black necrotic center of the pulp of these teeth that has been broken off. So I suspect that this dog did have some of his teeth cut off with a pair of pliers or something. Very horrible situation. And yeah, I really cried over this one. This was a sad case. So the difference, again, when it's a fracture, you see the pulp and you can get your probe into that. I mentioned earlier that it's different types of probes. This is one, you can see the black and white bands. I don't like that kind of probe. In this case, not only do we have infection that has gotten into the pulp of the tooth, but we've got significant loss. And here I can get my probe right underneath the tooth as well. Which is a good lead-in to the next thing you're going to be looking for, abscesses. So this is, again, a number 9 tooth. I believe this would be 309. And so you look at the gum line, doesn't look terrible, but you look below, down where the fold of the gum is, you see this big raspberry area of redness. That is an abscess that is formed down at the apex of the tooth. Sometimes you can get these teeth abscessing with nothing visible on the surface. And again, on X-ray, you can see this, but oftentimes if you do a thorough exam of the mouth, you will see that little red dot and know that you're in trouble. So at first glance, you'd say, okay, we have some gingivitis, we have some redness here, but don't forget to look down here. You can see that area of redness there. And often if you actually touch this with your probe, it will break right through and you'll get into the abscess pocket. Earlier on, I was speaking about deciduous teeth. This is one of the deciduous teeth I removed from a dog that had an abscess, and you can see the apex of this tooth has totally been destroyed by the infection. Another thing you'll find is non-vital teeth. So teeth that have been damaged by blunt trauma, usually. The pulp of the tooth is damaged and we now have a hollow shell of a tooth. Now, the textbooks all say when you have a non-vital tooth, you should do a root canal and save this dog from getting infection. And I suspect that is the right answer. But practically speaking, I have met a lot of people who have black teeth themselves and have been fine. And I have yet to meet a dog or a cat that has a non-vital tooth that got infection. The idea, though, is if you had blood-borne infection, it could get into the apex of that tooth and cause an abscess. And so in theory, this should have a root canal where you would cut it off, hollow out the pulp, put a filling at the bottom of it, and then have a dead tooth with no risk of infection. I find it hard to convince people of that, and usually I leave a non-vital tooth. Interesting though, if you look with a transilluminator and shine it through the tooth, you'll see the difference between a non-vital tooth and a regular tooth. Sometimes it's a little hard to say with just regular lighting, but if you shine a light through it, and an otoscope works rather nicely for that. Again, as you're doing your thorough dental exam, you may find tumors and cysts. Usually by the time you've got a tumor that's displacing teeth, that is game over for that particular dog. And it's important to note the difference between tumors and hypertrophic gingiva or infection. Tumors usually affect the bone and will push the teeth out of the way. So if you have a lump that's pushing teeth out of the way, for sure it's a tumor. If you have a lump that's just around the teeth, it may just be hypertrophic gingiva, and we'll get to that a little bit later as well. This is a dog that presented for nasty breath and bleeding from his gums, but it had this big tumor. This was about, I'm going to say 10 centimeters altogether, tucked in the back pocket of the lips. Again, a thorough exam is really helpful to identify these things. This is a young dog who had a cyst. You can see on the x-ray. What we could see in person on this dog was nothing. So the owners actually opted to do nothing in this case, but you could see that this cyst is very close to the canine tooth, very close to number 6 here, and ultimately I would have suggested removing tooth number 6, tooth number 5, and curetting out that cyst so that we would protect the rest of the teeth. But if you don't have x-ray, you might not even know this is going on. Another thing when you're doing your exam is look for foreign bodies. Oftentimes around the carnassial tooth, I will find wood slivers, I'll find chunks of bone jammed up in here that will fester away. But you may recognize this picture from another occlusion difficulty. This picture also shows a very common foreign body. This little thing here is hair. Dogs who have that wiry hair or have skin conditions and want to chew their legs will often end up with hair slivers that can cause profound gingival inflammation. This hypertrophic gum around this canine tooth often is, when you clean out underneath it, you'll find a lot of hair and stuff underneath there. Which brings us to the next one, gingival hyperplasia and stomatitis. So in this case here, we've got all this extra gum in the area. We can clean that up, but the pocket that's formed from this hypertrophic gum is around 4 or 5 millimeters deep. You're never going to have a healthy gum pocket that's more than 3 millimeters. So you've got to clean these teeth. You've got to trim that gum away to restore a normal depth of these pockets. Otherwise, within a week of doing a dental cleaning, you're right back to square one again. And here's an example of that nasty, horrible gingival hyperplasia. This all needs to be cut off. And sometimes it can take as long to do all this gingival resection as it does to do an extraction. Now, I just cut that, and if it bleeds a lot, I'll use a silver nitrate nail to stop the nail bleeding, or just direct pressure. Some people will use radiosurgery and stuff and get really excited about it, but cold steel will cut and all bleeding stops eventually. Another thing you'll find as you're doing your examination, you may find some caries or cavities, very common for people, very uncommon for dogs and cats, but if you look carefully, you'll sometimes see them. Here's one again on the lower carnassial where the enamel has been eroded away. I often see that on the upper carnassial or where there's deep grooves in the teeth, you'll have some infection get established and wear right through the enamel. Another thing you'll find as you do your exam, particularly in cats, is inflamed mouths. And the Latin for mouth is stoma. So basically the whole mouth-itis, stomatitis. Look at all that pus. That is a very, very painful mouth. And for cats, there's this complex immune interplay between the bacteria and the immune system. And the only treatment for these is to extract all the teeth in the mouth. In cats, you'll often see, particularly again in non-vaccinated cats, some oral signs of viral disease. So in this case, a severe calicivirus. You can see the ulcerations on the tongue and on the roof of the mouth. And in this case, it's actually a herpes virus that has caused a chronic periodontal disease that has actually filled in the periodontal space around these canine teeth with granulation tissue, and these teeth are slowly being pushed out of the mouth. And in this case, both of the upper canines are gone, and the socket is filled with granulation tissue. So vaccination not only saves their life, but also can save their teeth. In cats in Canada, not sure again in India what you're facing, but tooth resorption or feline odontoclastic resorptive lesions are a very, very common problem. And it can look very innocent on the surface. You see a little bit of red coming up there, but when you take the x-ray, you see that that tooth is all but destroyed. At one point, they were advocating doing fillings and stuff on these, and that is so wrong. These teeth are very painful. The problem, as you can see on the x-ray, is starting usually below the gum line, and we have run into a problem where we have destroyed the periodontal space, and putting a filling on the surface doesn't do anything for the cat. This hurts a lot. You'll often see a cat, if you probe this when they're under anesthetic, their jaw will quiver even though they're fully under anesthetic. That direct connection to the brain, they feel that. Again, they can be very irritated. I find for cats, this lower 7 is the more common tooth to be affected, but you'll often see the 9 affected. Here you can see the crown is so badly affected you can put a probe right through the hole where the tooth resorption. This is a good example of tooth resorption happening on a canine tooth. You have to really, excuse me, be mindful that this swelling around the base of the canine tooth, that's a really significant thing showing that there's quite likely tooth resorption happening there. And I believe my next slide shows you an x-ray of a tooth that has that kind of resorption. You see this root is virtually gone. What used to go all the way back to here has been moth-eaten and destroyed. Here's another one of its lower jaw. You can see the crown here. Interestingly enough, this was my cat who hated me when I was in the vet clinic. And as I was getting ready to give her anesthetic, she turned and tried to bite me and broke off that crown on this side into the gloves I was wearing. So the tooth has no structure left at all. And in these cases, what you need to do is do surgery just to do a crown amputation, and the process is completed. The Dental Society has come up with a way of naming these, which is not all that important, but it's really important to see the progress. This is obviously a very mild case. The only place you can see an issue on x-ray is this periodontal space being affected. Stage 2 is you have the furcation area of the tooth and more advanced periodontal disease, and it starts to invade into the dentin more so. Stage 3, you're getting into the enamel and the crown of the tooth, as well as destruction below. And then stage 4A, 4B, and 4C, which is mostly the crown in stage B, and mostly the root in stage A, and a combination of both in stage C. But the bottom line is the pulp cavity has been invaded. and that tooth is incredibly painful. Stage 5 is the ghost tooth. This tooth is not painful. You can leave that alone. But when you're looking at a mouth and you see that little raised area where the tooth used to be, I always like to run my probe over that because I want to make sure there's not a little spicule of crown left that is going to be a source of infection. All right, so a few more details and pictures along the way showing the degree of the stages of the tooth resorption. This is one that you sometimes get mislaid when you're taking the x-rays. You just say, oh, I can see a periodontal space, this tooth is okay. Don't forget to look at the crown. You'll miss this if you focus on the roots. This is the more classic one. You can see the periodontal space is totally obliterated. And for this one, again, removing the crown is most important. Again, you can see nice periodontal ligaments, but destruction of the crown of the tooth. So be mindful of this. Here's that stage 5. Again, if you run your probe over this surface, if you feel a pick, then there's some bone or some tooth sticking through. You should just make a gingival flap over that and burr away the rest of that because that can still be painful. Another way of describing this is type 1, type 2, and type 3. Again, whatever you call it, it is tooth resorption, very painful, and you should take the teeth out. Very painful for these cats. So thank you.